Your selection of the KaVo DIAGNodent is one of the wisest purchases your practice will ever make. We ask that you take a few moments to watch as we demonstrate the correct setup and assembly of the unit in order to ensure the maximum benefits this remarkable equipment offers. Unseal the box and remove all manuals and informational sheets. Please save all of this valuable information. Remove the base unit, spare grip sleeve, tip cassette, and battery. Making sure there is no tip in place, remove the grip sleeve by grasping the rear of the pen with one hand while grasping the front of the grip sleeve with the other hand. Gently pull in opposite directions to remove the sleeve. Insert the single AA battery into the base unit, noting polarity alignment as illustrated in the battery compartment. This is easily remembered by placing the negative side of the battery toward the spring. The low battery indicator will appear when the battery power reaches approximately 20%. This means it's time to change the battery in your DIAGNodent pen. Once the battery is inserted, place the grip sleeve over the base unit and slide it into place, making sure the sleeve tab fits into the slot on the base unit. Select a tip. Firmly push the metal end of the tip into the tip opening until it snaps into place. To remove or change the tip, gently pull on the metal base of the tip until it disengages. Once again, the laser tip must be removed prior to removing the grip sleeve from the unit. Turn on the unit by pushing the Start button until a beep is heard, about 1 second. The DIAGNodent pen automatically switches off when not in use after approximately 90 seconds. The user can also switch the unit off by depressing the Start button for approximately 5 seconds. Speaker control. The volume of the acoustic signal can be turned off or adjusted to different volume settings. Press the menu button 3 times so that the speaker symbol is displayed. Press the plus or minus buttons to select the desired setting. The unit will return back to the display mode after 3 seconds. Tips. The DIAGNodent pen comes with 4 occlusal tips enclosed in a sterilization cassette along with a calibration disc. Calibration. It is recommended that calibration be performed routinely with each probe tip change and before each new patient. While holding the unit in the air away from direct halogen light, calibrate by pressing the menu key once followed by the Enter button. A small 0 will appear in the display followed by a large 0. The display then changes to a letter and a 2-digit number, and the unit will emit an audible tone. When the audible tone begins, gently place the tip on the calibration disc at a 90-degree angle, holding steady. Please note, the tone must start before the tip is placed onto the disc. When the tone stops, calibration is complete and the unit is ready to use. The 2-digit number displayed during calibration should match the calibration number printed on the circular calibration disc. Each DIAGNodent unit has its own unique calibration code, so do not interchange calibration discs if your office uses multiple DIAGNodent units. During calibration, if the tip is pulled away from the calibration disc before the calibration tone stops, you will hear a tone and see an error message in the display window. This means that the unit has not been calibrated. If the error message appears, the calibration procedure must be repeated to ensure accurate readings. Once again, it is recommended that calibration be performed routinely with probe tip changes and before use with each new patient. Establishing a 0 baseline. Because levels of fluorescence may vary among patients, a baseline must be set for each patient on their healthy tooth structure. Prior to scanning tooth surfaces, select one anatomical reference point on a tooth surface which is apparently healthy. The middle third facial surface of a non-restored tooth is ideal. Hold the probe tip gently against the tooth at a right angle to the surface while either gently maintaining squeeze pressure on the black ring switch or by pushing the start button until set 0 appears. This is confirmed by 2 audible beeps. This indicates that the 0 baseline has been established for that patient. Scan tooth surfaces with light contact while monitoring the audio signal. Listen for an increase in tone pitch, which alerts you to observe the display to pinpoint the exact site on the tooth surface that corresponds to the elevated values. In fissure areas, the tip must be slowly rocked in a pendulous motion to carefully gather data from each pit and groove at various angles. Do not apply too much pressure on the laser tip, but do make contact with the tooth surface. Asepsis protocols for the DIAGNoDent pen tip can be adapted to meet the individual needs of the practice. The most popular method involves sterilizing the tip and grip sleeve portions of the DIAGNoDent pen up to 275 degrees Fahrenheit, 135 degrees Celsius. Chemical vapor sterilization is also acceptable. However, the harsher environment can degrade the tips and grip sleeves more rapidly. Always use the cassette for tip sterilization. After clinical use, remove the laser tip and place into the sterilization cassette holder. Scrub the tips under running tap water with a soft brush to remove debris. Place the tip holder in the sterilization cassette with or without calibration disc in place and autoclave up to 275 degrees Fahrenheit, 135 degrees Celsius. With proper care and maintenance, your DIAGNoDent will give you many years of valuable, trouble-free service. Additional information on DIAGNoDent can be found on this DVD, in printed materials enclosed with your DIAGNoDent, or from your KaVo or dealer representative. Visit the KaVo website for product updates.